Thank you, Wayne, and good morning to everyone. And thank you for joining this call today. And as you notice, we've made adjustments to accommodate the briefings that are just came out from briefing the Permanent Representative Committee and then this very important meeting. We will, I'll do the usual thing, which is give you an update of the epidemiological situation on the continent, as well as what we are doing to support member states, and then conclude with a vaccine and vaccination. So let's start with the epidemiological update. A total of 4.5 million COVID cases have been reported across the continent as of today, and that represents 3.1% of total cases reported globally. The total number of recovery stands at 4 million. That is of the 4.5. And then the total deaths on the continent stands at 121,000 deaths. And that represents about 4% of the deaths globally. Our case fatality ratio is still at 2.7%. And just keep in mind that the global case fatality ratio is 2.1%. The following 5 countries are accounting for about 64% of the total cases reported. That includes South Africa with 35% or 1.5 million cases, Morocco 11% or 510,000, Tunisia 7% or 305,000, Ethiopia 6% or 255,000, and Egypt 5% or 225,000. So the 38% of our member states, that is, are now reporting the elevated case fatality ratios. In terms of variants, we have now 20 countries that are now reporting the B117 variant. This is the variant, as you know, that was first recognized and identified in the United Kingdom. 4 additional member states, that is Cote d'Ivoire, Equatorial Guinea, Madagascar, and Togo, are now reporting the B1351 variant. This is the variant that was first identified in South Africa. And this brings a total of 22 countries that are now reporting that variant. And so we see that these variants are increasing. I would just like to make a point here that identifying one variant in a country or two doesn't mean that it has predominated the pandemic. It's just telling you how effective our surveillance systems are in picking that up. Now, the work we need to do now is to monitor those variants and to see if they are becoming the predominant variant in the country. So let's move on to the number of, and if you look at last week compared to this week, the trends that we have noticed. In terms of new cases, the continent recorded 75,896 new cases between last week and this week. And that represents an 8% decrease from the previous week. The highest proportion of new cases came from Northern region or Northern Africa, and that was 38%. The other regions recorded the following changes: East Africa, 29%, Southern Africa, 22%, West Africa, 7%, and Central Africa, 3%. The following 5 countries are reporting the highest number of new cases: Tunisia, Ethiopia, South Africa, Egypt, and Kenya. If you look at the deaths, the total number of deaths recorded between last week and this week stands at 2,184 people dead. And that represents a 2% decrease in when you compare to last week. Let us now look at the 4 weeks trend. That is in the last, the period between 29th of March and 25th of April. So in terms of total number of new cases, overall, there have been an average 0.3 average decrease in new cases when you compare over the last 4 weeks. The following are regional trends: 12% increase over the last 4 weeks in Northern Africa, 5% increase in Southern Africa, a 4% decrease in East Africa, 11% decrease in West Africa, and 18% decrease in Central Africa. The following are breakdowns by the most populous countries over the last 4 weeks. DRC, 15% average increase. Egypt, 8% average increase. South Africa, 5% average increase. Ethiopia, 5% average decrease. Nigeria, 12% average decrease. And Kenya, 14% average decrease. In terms of deaths, new deaths, there have been an overall 3% average increase in deaths reported in Africa over the last 4 weeks. The following is a breakdown by the most populous countries. Kenya, 8% increase. Ethiopia, 7% increase. Egypt, 2% average increase. South Africa, 4% average decrease. DRC, 21% average increase. And Nigeria, a 69% average decrease. Let's look at the testing. As a continent, we have conducted a cumulative number of 43 million COVID tests since the pandemic started. Over 2.6 million tests of these tests, that is the antigen tests, have been conducted across 12 member states over the last couple of weeks. So just last week, 790,000 new tests were conducted, and that represents an average 26% slightly decrease in 26% decrease from the previous week. Now, in terms of the capacity building, we continue to carry out regional workshops for training vaccinators across member states and for vaccination. And that is a nice segue to go into the vaccine updates. As of 26th of April, 2021, a total of 37.1 million, excuse me, 31.7 million vaccine doses have been acquired by member states, with approximately 17.9 million doses being administered. This figure corresponds to a coverage of 1% of the continental level, with 0.37 of the population having received a full vaccine regimen, 0.37%. In terms of progress, the following are the top 5 member states that have administered the most doses of vaccines based on available country data. Morocco has administered 8.9 million doses. Morocco has 8.9 million doses, having used 82% of its supply. 11.4% of the population is now fully vaccinated. Nigeria, 1.2 million doses, 27.7% of supply use, 0.57% of the population vaccinated. Ethiopia, 908 doses, is 36.3% of its supplies and 0.7% of its population vaccinated. Ghana, 842,000 doses, 100% of its supplies use, 2.7% of the population vaccinated. Kenya, 822,000 doses, with 80% of its supply use and 1.5% of the population vaccinated. As of 24th of April, Africa CDC published an updated statement on member states following the report of the rare blood clotting events that accompanied the Johnson & Johnson vaccine, essentially saying that the benefits outweigh the risks, and it should be we should continue to use that. The following evidence from the different regulatory bodies. I mean, we know that the European Medicine Agency, the US CDC, and the FDA have also issued very similar guidelines with respect to the Johnson & Johnson. So in terms of, just to conclude, in terms of the Democratic Republic of Congo, you've heard that they are returning 1.3 million out of 1.7 million doses of vaccines that they had received from COVAX, and UNICEF will be taking back those vaccines to redistribute to member states that have been having, that are in need of that. I think that is in recognition of the fact that the DRC is acknowledging that they may not be able to use all the vaccines before the shelf life. I would then conclude by saying that it is really, we are watching with total disbelief what is happening in India. The situation in India is very, very concerning to us as a continent. We watch it, as I said earlier, with a total disbelief of what is going on. And of course, it speaks to the fact that we as a continent must be very, very prepared. Prepared to that the same scenario that is happening in India can eventually happen on the continent, and we must then continue to raise our guards. And in that effect, we are working with the Office of the Chairperson of the African Union Commission, Excellency Musa Faki Mohammed, and the Chair of the African Union, His Excellency President Tshisekedi, are working hard to convene an emergency meeting of all ministers of health on the 8th of this month. That will be next Saturday, to address the situation on the continent and put everybody on the alert. We should not and cannot let our guards down with respect to what is going on we cannot be indifferent with what is going on in India, and it can happen anywhere. And so that meeting, that emergency meeting, will begin to look into what we must do collectively to ensure that such a scenario doesn't happen on the continent. Over to you, Wayne.
Thank you very much, John. And our first question is really very related to that last point that you mentioned about the situation in India. And it's coming from Kara Anna, who is with AP. And she says, how do you feel watching the events in India and knowing that many African countries' health systems are even more vulnerable? Now, you've addressed that, but there's the issue of the vulnerability of our health systems that Kara is raising.
No, Kara, you're absolutely right. As I said, we are watching the situation in India with total awe and disbelief. And this is a scenario where, if you see where India was just a few weeks ago, I mean, really, say in March, they were reporting about 36,000 new cases. That is how low it was. India is a subcontinent of almost the same size of a number of people as Africa. And if you see that today, their graph just went up. Their daily average just went up like that. I mean, not even like this, like that. And they are now reporting about 350,000 cases a day. That is a scenario where it is catastrophic for the health system, for any health system to bear. So that is why we are really saying, as a continent, we need to regroup urgently and discuss ways to get ourselves prepared. It's better to be over-prepared and not have that scenario than to be surprised by that scenario. So that is really will be the core of what strategy do we adopt in the midst of that. I think on that, there are a couple of messages that I really want to leave the continent with. One is, it's really a strong appeal to the continent that do not have mass gathering. Do not have a mass gathering. They will promote the opportunity for the virus to replicate, and we find ourselves in where India is, period. We cannot be complacent and begin to have these large gatherings then. Avoid it as much as possible. The same measures that we took early on last year should be begin to consider implemented. That is extremely important. Religious gatherings, parties, groupings are all opportunities, or political party gatherings are all opportunities to offer the virus the opportunity to spread. And we cannot and should not find ourselves in that scenario because of the very fragile nature of our health system there. Mass is key. Mass work. For now, they are the only effective vaccines that we have, vaccines in quote unquote, that we have because they do protect people from infection. You protect yourself and protect loved ones. And of course, social distancing as much as possible. There's a lot we can do to prevent that scenario happening in Africa, but we must take it seriously. Then plus the variants are spreading, and I believe some of what is happening in India is fueled by the new variant that is spreading in India, and with the 617 variant, and we have to take that very, very seriously.
Thank you very much, John. Still on the situation in India, Nita Bala from the from Thomson Reuters Foundation, and Nita is the East Africa correspondent for Thomson Reuters. And the questions are very similar to what you've asked, but the one that is different that Nita is posing is what impact is India's vaccine export ban having on national rollout plans in Africa, and what measures can countries take to ensure that everyone gets vaccinated?
So there is no doubt that the India situation, as we have discussed on this platform already, has severely impacted the predictability of the rollout of vaccination programs, and will continue to do so for the coming weeks and perhaps months to come because of the situation we are seeing in India. India is in short supply of vaccines. We all heard the announcement from President Biden just this week saying that he and Prime Minister Modi discussed, and the United States was actually going to be supporting India with vaccines. So if India, that is producing vaccines at the Serum Institute, cannot even meet its own needs, I don't know how they can support export vaccines to Africa. So we find ourselves, as I said earlier, in a very dicey situation with respect to vaccines. That is why continuous adherence to public health measures until the vaccine situation gets resolved will be very, very important. As you recall, we have signed a contract with the Johnson & Johnson to acquire up to about 400 million doses of vaccines, 220 doses to start with an option for an additional 180 million doses of vaccines. That supply will start hopefully, not hopefully, but the agreement and the contract says it will start delivery the first quarter, the beginning of the third quarter. So I think that is what we have in our hands, and we are doing all we can to address the situation from the African Union side as much as possible. But we find ourselves collectively in a very, very dicey situation. We will be discussing with COVAX tomorrow, that is the AVAC, the African Vaccine Acquisition Task Team, and COVAX will be discussing tomorrow at the leadership level to see where we can coordinate efforts and support each other. That is a standing meeting. We usually, AVAC and COVAX usually meet to discuss that, but it's become even more critical as we're dealing with a shortage of vaccines across the board.
Thank you very much, John. We have another Reuters correspondent, and Maggie Fick is online. Good morning, Maggie. Please go ahead with your question. Hello, Maggie, your microphone is muted.
I'm so sorry for the delay. Can you hear me now?
We can hear you very well. Please go ahead.
Thank you. So, Dr. John, some countries are rolling out vaccines quite slowly for various reasons, including vaccine skepticism. So my question is, how many countries have vaccines that might expire before they are used? Are you able to give us a number on that at the moment? And also back to the question of India, we're wondering what your position is on the cutting of flights with India as Kenya did yesterday. Thank you very much.
The vaccines, we know as of now that DRC has expressed their willingness to give back the vaccines to I think 1.3 million doses of vaccines back to the COVAX mechanism, and UNICEF is working with them to get it out and redistribute it. The time line for that is really like 5 weeks, where they have to do it quickly and get that out and get it into the arms of people across the continent, different countries across the continent. And I think COVAX is working with them, and we remain optimistic that the vaccines will be shipped out quickly and distributed so that they can actually be used, especially in this extremely critical time. We don't know of any other countries that received their COVAX doses and are expressing the inability not to use the vaccines. We are not aware of any for now. It doesn't mean they are not there. It's just that, but it's a strong call. This is a very important call that I'm making to countries, that if you anticipate that you will not use your AstraZeneca doses that were distributed, reach out back to COVAX or to us, Africa CDC, so that we can work out ways that the vaccines can be redistributed to other countries there. Do not wait until the last moment, and then we develop a narrative that expired vaccines and then they cannot be used. I think it is in nobody's interest if we keep working in that way. I think total transparency in the way we conduct ourselves in this very, very challenging environment is very, very important. Is absolutely, we have to do our own part. The COVAX, AVAD, countries must do their own part to really scale up vaccination once they get those vaccines. With respect to the second question was about banning of flights to and from India. I think the whole, it is really unfortunate that we are reacting in a very ad hoc manner across the world with respect to flight movements from countries to country. I think my hope and belief is that we still should seek for the overall guidance from the World Health Organization in the context of the international health regulations. And people, we should make a difference between people and the virus. Okay, if I travel to India, with a negative, an authentic negative PCR test, I bear no risk, okay? Or and vice versa. If someone from India travels to Kenya with a negative, an authentic negative test, it is not the people that are a threat, it is the virus. So the virus is the enemy, not people. So my position as Africa CDC is that we should continue to go with a trusted travel platform that we instituted. Make sure when people travel, they travel with an authentic and validated negative PCR test for COVID. If you do that, then the person is not the enemy. Then there is the virus that is the enemy. Then there is no way that someone arriving from India with a negative test in country X who pose a danger or a threat, and vice versa across the whole world. There are other several African countries that are on the red list for people to travel to some other countries there. So I think we really need, as the international community, to harmonize our position so that the position doesn't get even more dire than it is now. I think we find ourselves collectively as a world in a very, very challenging situation. So if we keep targeting countries there, then we cannot solve the problem. It's not just Kenya doing that. I think so many countries are doing that across the world. But I just want to leave you with this message that as a virologist, what I know is that if you travel with a negative test, you do not pose a threat to the country you are visiting there, period.
All right, thank you very much. Let me call upon Sui Liwi, My apologies, Sui. I know you were the first one to raise your hand, but I missed you somewhere there. So good morning, Sui Li Wei. Please tell us your news agency and then ask your question.
No problem at all. Thank you very much. I'm from the New York Times. I'd like to confirm a China Daily report that the Africa CDC is in talks with China's Sinopharm to buy vaccines. Could you confirm this? And if this is correct, can you provide details? How many doses and why is the CDC choosing Sinopharm right now? Thank you very much.
No, we are in discussions with all pharmaceutical companies, and this is, excuse me, and this is absolutely not a diplomatic statement. Anyone who says they have a vaccine, we are talking to them and say, tell us what the vaccine is. Let us review the dossiers and let us understand what your supply capacity is for the continent. Then we've talked to the Bharat Biotech, we've talked to Sinopharm, we've talked to Sinovac, we've talked to Sputnik, the people producing Sputnik, but we have not, really be very, very clear here, we have not signed any, we have no agreements with any pharmaceutical companies for vaccines other than Johnson & Johnson. And we have no contracts with any pharmaceutical, any vaccine producers other than Johnson & Johnson. Anything else is discussions with anyone who says they have a vaccine. And I mean all, everybody that is available, we have talked to them. We as AVAC have talked to them. So, but no agreements, no contracts signed with any of the companies. We believe that the Johnson, that countries, African member states should actually focus on picking up the 220 million Johnson & Johnson vaccines. That is a single-dose vaccine. It is what I call a good programmatic vaccine, and I have no shares, no contract, no conflict of interest with Johnson & Johnson, strictly from a public health perspective, and also strictly from our continental imperatives of how to roll out vaccination. I mean, we went with that vaccine. It's produced in South Africa, and I think we are we remain optimistic that if once that those doses begin to be supplied, the continent will be in a very good place to roll out their vaccination program. So we have not entered into any agreements with any other vaccine manufacturers for now.
Thank you. Let us take a question from Adis Getachew, and Adis is the correspondent for Anadolu News Agency. So Getachew says, it is known that Africa has logistical challenges in delivering vaccines. Tell me the time that it is taking between shipment and arrival to destinations of vaccine consignments. This is one aspect of his question. Then he says, what lessons have been drawn in this regard, and what better course of action and procedures should be pursued among African stakeholders to resolve these logistical challenges? And then finally, he says, what advice do you give to African countries in the handling, distribution, and administration of the vaccines?
So very good questions, and I'll answer them in a block as such. That the challenge that we have on the continent is twofold. One is acquiring the vaccines for COVID, and two is vaccination at scale and at speed. Vaccination at scale and at speed. The continent as a whole knows how to vaccinate, okay, and has been vaccinating. I mean, for other diseases. May I just give you an example, which I've cited here over and over. In the middle of this pandemic, Ethiopia was able to vaccinate 12 million children with the measles vaccines. 12 million children with the measles vaccines. So that suggests that if the vaccines are available, countries will be able to vaccinate them. The vaccines that we are using on the continent now are mainly designed as other vaccines that the continent is used to handling, like the polio vaccines, that polio, measles, and others that require a 2 to 4 to 8 degree storage. It's not an ultra chain that is required. People can vaccinate using the same systems. But the key is, how do you scale that up? And how do you do that at speed? Okay, because we have to be ahead of the pandemic. That is the way you need more partnerships. where countries need more support. You need more support to scale up vaccinators. You need more support for the commodities, okay, the vaccination-related commodities, including personal protective equipment and others. So that's what we need as a continent. But the know-how is there how to roll out vaccination. These are not vaccinations of under 5 years old or early childhood vaccination. This is vaccination the entire population. So I think that is where the challenge is. I mean, that's the way I would address that question.
Thank you very much, John. We go over now to our WhatsApp group, and we have questions coming from Sarah Jerving, who is with DEVEX. And she says, can you please provide more details on why the agreement for 270 million doses agreed upon in January for Pfizer and AstraZeneca doses fell through? What were the factors that made that deal fall through? And do you have concerns that the Johnson & Johnson deal for 400 million doses might not materialize? Finally, Sarah says, what are some of the factors that could impact whether or not these doses are actually provided to the African Union by Johnson & Johnson?
Very good questions. So there are two things that I'm learning in this whole process. One is that there's an agreement, and then from agreement you move to contracting, which is what, as I said, I'm learning. So in January, we had agreement with that they will supply us with those 270 million doses of vaccine, and mainly a lot of them were from the Serum Institute and Pfizer doses there, which was nicely outlined to you all. Now, then we run into issues of the ability and for the suppliers to have those the volumes, okay, of that. And I think that is what I've explained earlier, that we to you all last week and the week before that we all realized at that time, especially with the Serum Institute, that COVAX was working with them as well to get vaccines. And the vaccines were all still coming to the continent. So there was no point for us, two groups that are struggling to get vaccines from the same source and going to the same people, tipping on each other. So we, as I said earlier in this briefing, we do talk to COVAX leadership all the time. It made sense that because of the limitation in what the Serum Institute could supply at that time with respect to the AstraZeneca doses, that we will look for somewhere else and allow the COVAX to focus on working with the Serum Institute. So it was not walking away from any agreement. It was rather a recognition of the reality of the scarcity that existed at that time. So I think that is that. Now, with Johnson & Johnson, so remember I said agreement. There was agreement, there was no contract. With Johnson & Johnson, we've had agreement, and now we've had a contract signed, which is a legally binding document signed. And just last week, the Afri-Exim Bank already paid $350 million as part of the advance procurement. So this is really, it has some teeth behind it, it's moving on. And we should always interpret anything that we do in the vaccine market like it's extremely fluid. Okay, the COVID vaccine situation is very, very fluid. You all now know that the COVAX mechanism and some European countries are threatening legal action against, I think, AstraZeneca or Serum Institute about that. So it's just a challenging situation we all find ourselves in. So we will give you the best of the information as much as we can. If the situation changes, we'll tell you that it has changed. So for now, Johnson & Johnson is a firm contract, legal binding, backup with already about 350 million paid already into their accounts. Member states must now pick up those doses from the platform, that is the AMSP platform, the African Medical Supply Platform. Will something happen with the contract in future? I mean, the wise saying is always never predict the future. I mean, what the future will look like. And we are living in a world that is extremely uncertain now with respect to the COVID situation and vaccines. A typical VUCA moment where it is volatile, it is uncertain. it is an ambiguous situation. Yeah, so we are living in a true vocal moment with the vaccine distribution in the world.
Thank you, John. It's time now for us to say good morning to Peter Fabricius, who is with the Daily Maverick in South Africa. Peter, good afternoon.
Yeah, hello. Gwen, thanks.
Go ahead, please go ahead.
Thanks, Dr. John. Can you hear me?
Yes, we can hear you.
I can hear you very well.
Okay. I just want to be clear about something. You may have discussed this before, but are you very concerned about the fact that the DRC, for example, was unable to administer so many vaccines? I mean, clearly it has a huge need for all of those vaccines. What happened, and are you able in any way to assist? I mean, it's probably too late now, I guess, because of the expiry. But just what the response is of the CDC to the Africa CDC to that issue. And if I may also, you talked about that you're trying everywhere else, but it didn't sound to me like you were very confident that, for example, Sputnik 5 or Sinopharm vaccines would be part of the Africa CDC menu anytime soon. And I'm just wondering are there still issues about, verifying the safety and efficacy of those vaccines? What is the issue there? I mean, we're quite a long way from the J&J. There obviously is a shortfall that needs to be filled. Thank you.
Thank you, Patrick. Let me start with the last question, then I go to the